I guess, we've seen something of a turning point with this coming into the election. I mean, Premier Smith has talked about this issue a lot, and I've been happy to see that. But with her recent press conference, she's broached the issue, I guess, of imposing treatment upon people. But maybe I'll back up a bit before we get to that. You've worked, of course, for decades in treating youth and treating people with addiction. And you've had a great deal of success stories. Like the fact that somebody who has received treatment is certainly much more likely to break free of addiction than somebody without. We'll start from there.
Yeah, thanks for having me and carrying this message. I came to Calgary 33 years ago, and I started on the reserves of Saskatchewan and Kamsack and the Cote Reserve, and had the highest suicide rate in Canada. I went and worked in the States, and I started my doctoral work out of Cincinnati, was living in Vancouver. And I came here 33 years ago, and the research was not good about reaching youth. And that's what I speak to. I don't speak to adults, although we treat families, but I'll speak to the youth issue, that youth were dying. It was a pandemic. And I didn't know if we could really help these kids, because from the academic research and programs to reach these kids, they just weren't available. So I spent 5 years with an incredible doctoral team before we even got out of the chutes, developing our model. So 33 years later, came to know that there's a solution and we can reach these kids. It's just like you said, the most agonizing thing I've ever faced is a parent losing their child. That includes, like, from the Cote Reserve. Today, Cote Reserve has the highest HIV rate in Canada. What's changed? Well, what's changed for us in Calgary and the kids we treat, we came to know that we can help these kids. But it's tough, it's complex, it's the toughest thing I've ever done. But I want to tell you, it's also the best thing I've ever done. But it's labor intensive, it's high risk. And who wants to wade into these kids that don't want to stop, and they're dying. And so that's where I've spent 33 years seeking a solution to help those kids, 365, 24/7. It's a tough business, but majority of our kids, and I've sent this to you and I can show you this, is the research. Like when you talk about, I can have the anecdotal stuff, which is very powerful. I keep saying to my kids and parents, you not only have a message, you are the message. But to validate what we're doing, I've had to look at the legal aspects of it. I had to look at the clinical aspects. How do you deliver a program? How do you raise the money to keep it going? How do you access government support? It's very complex, but we've never varied, Corey, from our primary purpose of reaching that kid every day. And we came to know, we know how tough it is. We know it's high risk, but we know that we have a solution. So I can get going on this. But I think what Danielle Smith and Marshall Smith and these guys have done is given us a voice to share our message that there is a solution for these kids, but you got to raise the bottom. They are so sick. They are so mentally ill that they cannot stop. And there's nothing more painful than a parent watching their kid deteriorate in front of them, and it's hopeless. But to help them, that's what we work on every day, Corey.
Treatment for somebody when they're heavily addicted can take, I believe it was 3 to 8 months typically with what you guys offer. And sometimes the results you're looking at over 50% will stay clean. But some people say, well, boy, then half aren't making it. But I mean, it's far, far better than people who don't get treatment at all. And that's what people have to understand, that if left alone, the outlook for a person who's heavily into addiction, it is not good.
Well, I think, what's the success rate of these kids in 1989-90 was very, very low. It wasn't 50%. In fact, we know from our research, I had to go outside of the province to go to the Treatment Resource Institute, for instance, with Dr. Winters and Dr. Area to validate academically our program. Like you talked earlier about results. I'm into results. Otherwise, 33 years, I want success. My job is for that kid in the first chair who doesn't want help, that's really sick, that's addicted to drugs. I want to see results. So with our research, I've had to validate ARC, fight this in our own community and province to show academically that the majority of our kids stay clean and sober. That's ridiculous number. But I've had to go outside. I can provide that research. The other research, there's our research, Dr. Rinters, Dr. Area, which is published, that our average length of stay in treatment is 277 days. It's not rehab, it's habilitation of taking a kid and setting them up to win. Treat the addiction. We have a psychiatrist. We have multiple people that will help this kid. It's labor intensive. So we know that its average stay it's going to take time. So why do those kids stick around ARC? Why do those kids stick around for 277 days? Because they know they can win. Now, some don't, but the majority do. The other part, our research from Patton in 2004 and Winters and Urea, three studies say that 8 out of 10 kids that start the program finish. Now, that's 277 days. These kids are in treatment. Level 3 and 4, they go out to school, they go out to their community, we habilitate them. The number one predictor of success in the research of kids that are sober after treatment doing good in their life is called retention. So 80%, we've got 2 major studies that say 80% of our kids complete treatment and have a better chance of making it out in life. And we're treating kids that nobody wants to treat, because we got to raise the bottom, because they can't see, they're so sick that they are killing themselves. So what's the option? Let them die?
Well, and that's
so I
it.
have a parent that says, yeah.
Oh, I'm sorry to interrupt, but yeah, and I've seen a couple of the commenters. It sounds like their children have gone through your program, and they really appreciate it. And they're using that term compassionate intervention, because that seems to be the part that some people are hung up on, is you have to intervene, even if the person initially perhaps isn't necessarily willing to go into treatment. They've had the parents intervening on their behalf or other loved ones, and you aid with that. And as you pointed out as well, it's a mental health issue. So, I mean, they're not necessarily making good choices initially. You need to stabilize their thinking. So
that's right.
Where you begin intervention?
Well, I think going back to this, parents have rights, and I'm talking about youth. And the issue is capacity. When they're mentally ill, the parent has a responsibility and the right to help them and protect them. And so legally, it comes down to capacity and a parent having rights here to save their kid. They've been everywhere by the time they get to me. They've been through the system. So where do you start? You start by talking to other people, I guess. That's the best referral to me, is other parents that have gone through this, that have been shattered, that found hope, put their families back together. It's the same thing with my staff. I work with a team of miracles. They've all been through it. Now they're getting masters and getting educated. They know there's a solution. And so where do you start? Well, I've been there 33 years, Corey. There's nothing I haven't seen. There's nothing, the attacks, trying to access government support. What Danielle Smith is doing, I am astonished at her stepping in and having the courage to step in. And it is compassionate. These parents love their kids. That's compassion. It's compassion for us. We care about those kids. They will ultimately get better because they'll tell you they know we care. And it's in our simple actions of stepping into that disease with a solution. Hope is in human form at ARC. That's my whole staff of carrying that message. Not only the staff, but the parents that get its results. And that's what kept us alive over all these years. Now the government stepped up, which I think is incredible, to support us in intervening with kids and raising the bottom and helping them get help when they don't want help because they can't see it. They're too sick.
Yeah. So something that unfortunately has gotten very politicized and we've really kind of polarized this, unfortunately, rather than just looking at results, is issues of safe supply or harm reduction. Like, I'm kind of on the fence with some of that. If an addict is dead, well, we can't help them. So if we could keep them from dying on the street and hopefully get them into treatment soon. There's a role for harm reduction, but some people seem to see harm reduction as if it's an end, or that you can facilitate an ongoing addiction and it can be functional. And I think that's where the trouble starts beginning.
Well, I'm not against harm reduction. And you're looking at the continuum of care and the continuum of recovery. So certain people, if they don't have to come to ARC and they can cut down and not destroy their lives, I'm all for harmful reduction. But when you reach a point, and there's many, many kids, our research is showing, these kids have passed the stage of harmful reduction. They will use till they die. You step in front of their disease, it's going to be nasty because they're addicts. So ours is abstinence. I've been at this 35 years. I don't see any other solution for my kids. I've seen kids go back. Majority of our kids make it. Some go back out. They die because they start using again and they progress right back into the disease. So it's very difficult to treat them. But when you have the majority of the kids getting better, like I just had my gala, 31 years. How many of those kids are contributing to society? The best part of my job, Corey, to me, because I'm a senior citizen now, is watching my graduates be parents of their kids. And they're good parents and they're good people. And they know that they have a solution. So they're the best message I have. On the other part, I have had to look at the academic stuff. Our results speak for themselves. It's high-end, solid research from outside people. The other part is looking at the legal part. Parents have rights. Kids are sick. So that's the stuff that gets all thrown into the part of a kid that's so sick. They don't have the capacity, and a parent has, I believe, the right to step in and do what's going to help that kid or give him a chance anyway. That's what we're doing. We're giving them more than a chance. We're giving them hope, but it's hope in human form, because the kids that you may have seen or talked to, they'll tell you without an intervention, they're dead. So what do we got to lose, Corey?
Oh, absolutely.
It's well thought out. It's not just we're throwing this at you. It's 33 years of research and experience, and we have a message. Now we have a government, and I hope whether it's Danielle or Notley, come and support us, man. We're saving kids. It's not even a political issue. It's an addiction issue.
That's right. It shouldn't be. And as you pointed out, I mean, still, it's a very resource intensive. You guys have been fantastic with your gala and fundraising and things, but it's still never quite enough. I mean, with a government, hopefully, that seems, no matter which government, more inclined to help fund these spaces, because that's what you need, and the resources and the professionals to help. It's so important. I mean, we shouldn't look at it as an expense. I think you look at it as an investment, because as you said, the payoff of sober grown children, we have a much better world for it all around. So I knew 15 minutes wouldn't be long enough. I know I'm going to have to talk to you again sometime down the road. Anytime. But you sent me some fantastic studies and statistics and documents. Where can they find those online, and where can they find your organization if they want to donate, or if perhaps they need help or anything like that?
Just look up Alberta Adolescent Recovery Centre. We have a website. Same thing with the research. I think that's very important, Corey, is the research of validating that this program, after 30 years, is showing pragmatic, real results. But that just allows me to go in there today, which we're doing, to carry the message and save kids. When we get people behind us, and I've never seen this in 30 years, what Danielle and the UCP are doing, and hopefully NDP, Notley, that can see that we have valid results academically, but most important is the families. If we did an economic study of all those kids that are out in the community, working, going to school, 30 years, it's a huge investment in our youth. But I want to just clarify, and I get going on this, but saving a life, there's nothing better. But this is tough, hard business. Those parents love their kids. They're committed to come walking in the door of ARC. And that's the model. We've created a unique model that's working. So now let's get out and carry it to other communities. Best thing we do is do what we're doing here today, carry the message. So thanks for having me. I appreciate it.
All right. Thank you very much, Dr. Vause, and for the work you do and for sharing that with us. And I really do hope we get to talk again soon.
Thank you.
So again, guys, that was, yes, Dr. Dean Vause of the Alberta Adolescent Recovery Centre. And, it's powerful, right? And as you can see, it's so much work. And I see a lot of the commenters, people have been looking forward to hearing from it. I mean, it's just such a good sign right there. You can see there's people who that center has helped. It's helped their children. It's helped them. Night Shift saying Dr. Vause saved his family. Tony Brady saying AARC saved my son and family. What a team. And that's the other thing, to be mentioned. There's a whole bunch of people involved in that, and what a tough job. I mean, it's like nurses in any other medical ward or doctors or health professionals. I mean, you have to be so strong to deal with when things don't go the way you want and still get up in the morning and get in there and keep working on it. And this is so worthwhile. Jamie Johnson, after 12 overdoses and multiple suicide attempts, my son's not talking about a future, including university. Thank you to the doc and his staff. Melody James, compassionate intervention saved my son's life. Dr. Vause and his team taught him and my family the way out. Like the comments are just coming and coming. And, Desiree Presley, most of his staff have been through treatment and are living examples of what recovery looks like. And that's another thing. And that's what with a lot of recovery groups and organizations, it starts to become anecdotal. And sometimes you see the academics poo-pooing that or pushing it aside. But no, there's a reason you see things like, again, yes, I'm a member of Bill W.'s group. We're talking about groups where you can get together with other people who have suffered through the addiction you have, because that's how you can lend support to each other. Because somebody who hasn't endured that, while they might mean the absolute best and might have all sorts of things they can help, you can't beat having somebody who's directly known how to deal with that. It's very important. And every situation's a little different too. Some people have harder times, some people have easier times. It's just there's no cookie cutter approach, and you need as many all hands on deck.
Canadian Shooting Sports Association. Without the CSSA, our gun rights would have been taken long ago. These guys are on the front lines helping to draft smart and intelligent firearms regulations and legislation in Canada, and more importantly, educating the public about how we keep guns out of the hands of the wrong people. To become a member, it's absolutely worth every penny. You can become a Western Standard member for just $10 a month or $99 a year for unlimited access